Hello viewers, like I promised, this site will be bringing to your listening view information on health, politics, entertainment, education, and so forth. Today, I'll be discussing with you 5 deadly diseases outbreak we should watch out for. Firstly, I have here Ebola virus. Ebola virus, also known as Ebola hemorrhagic fever or simply Ebola, is a viral hemorrhagic fever of humans and other primates caused by Ebola viruses. Signs and symptoms typically start between 2 days and 3 weeks after contracting the virus with a fever, sore throat, muscular pain, and headaches. Vomiting, diarrhea, and rash usually follow, along with decreased function of the liver and kidneys. At this time, some people begin to bleed both internally and externally. The disease has risk of death, killing between 25 and 90% of those infected, with an average of about 50%. This is often due to low blood pressure from fluid loss and typically follows 6 to 16 days after symptoms appear. The virus spread through direct contact with body fluids such as blood from an infected human or other animals. Spread may also occur through contact with an item recently contaminated with bodily fluids. Spread of the disease through the air between primates, including humans, has not been documented in either laboratory or natural conditions. Semen or breast milk of a person after recovery from EVD may carry the virus for several weeks to months. Fruit bats are believed to be the normal carrier in nature, able to spread the virus without being affected by it. Other diseases such as malaria, cholera, typhoid fever, meningitis, and other viral hemorrhagic fevers may resemble EVD. Blood samples are tested for viral RNA, viral antibodies, or for the virus itself to confirm the diagnosis. Control of outbreaks requires coordinated medical services alongside a certain level of community engagement. The medical services include rapid detection of cases of disease, contact tracing of those who have come into contact with infected individuals, quick access to laboratory services, proper health care for those who are infected, and proper disposal of the dead through cremation or burial. Samples of body fluids and tissues from people with the disease should be handled with special caution. Prevention includes limiting the spread of the disease from infected animals to humans. This may be done by handling potentially infected bushmeat only while wearing protective clothing and by thoroughly cooking bushmeat before eating it. It also includes wearing proper protective clothing and washing hands when around a person with the disease. No specific treatment or vaccine for this virus is available, although a number of potential treatments are being studied. Supportive efforts, however, improve outcomes. These include either oral dehydration therapy, drinking slightly sweetened and salty water, or giving intravenous fluids, as well as treating symptoms. This disease was identified in 1976 in 2 simultaneous outbreaks, one in Nzra and the other in Yambuku, a village near the Ebola River, from which the disease takes its name. EVD outbreaks occur intermittently in tropical regions of sub-Saharan Africa between 1976 and 2013. The World Health Organization reports a total 24 outbreaks involving 1,716 cases. The largest outbreak to date was the epidemic in West Africa, which occurred from December 2013 to January 2016 with 28,616 cases and 11,310 deaths. It was declared no longer an emergency on 29 March 2016. Other outbreaks in Africa began in the DR Republic of Congo in May 2017 and 2018 till date. Secondly, I have the Zika virus. Zika is a virus that is spread mostly by mosquitoes. A pregnant mother can pass it to her baby through pregnancy or around the time of birth. It can spread through sexual contact. There have also been reports that the virus has spread through blood transfusions. These have been outbreaks of Zika virus in the United States, Africa, South Asia, the Pacific Islands, parts of the Caribbean, Central and South America. Most people who get the virus do not get sick. 1 in 5 people do get symptoms, which can include a fever, rash, joint pain, and pink eye. Symptoms are usually mild and start 2 to 7 days after being bitten by an infected mosquito. A blood test can tell whether you have the infection. There are no vaccines or medicines to treat it. Drinking lots of fluids, resting, and also use insect repellent. Wear clothes that cover your arms, legs, and feet. Stay in places that have air conditioning or that use window and door screens. Thirdly, I have the Middle Eastern Respiratory Syndrome known as coronavirus. What is this virus all about? This virus is a viral respiratory illness that was first reported in Saudi Arabia in 2012 and has since spread to several other countries. Most people who contracted the virus presented with respiratory symptoms, and about 3 to 4 out of every 10 people infected died, according to the Center for Disease Control and Prevention, CDC. How is it contracted? It's a virus that can be transmitted from the dormitory camel to humans, but can be further transmitted through bodily fluids. Signs and symptoms. According to the CDC, the incubation period can be anything from 2 to 24 days, with an average of 5 days. Symptoms start with a fever, cough, chills, and headaches, but can also include nausea, abdominal pains, dizziness, and sore throat. The latest outbreak was reported by the World Health Organization in October 2017 in Saudi Arabia. Another recent outbreak occurred in August 2017 in the United Arab Emirates. Fourthly, I have here human infection with avian influenza. What is this sickness all about? According to the CDC, human infection is an Asian lineage of avian influenza virus. We are first reported in 2013 in China. Most cases of human infection with avian influenza occurred after exposure to poultry. How is it contracted? It is contracted through infected birds and poultry. Signs and symptoms of this disease. Most people who contracted this virus seriously display respiratory illness symptoms. The 4 symptoms include fever and flu-like symptoms such as body aches and headache. Other possible symptoms include diarrhea, nausea, and vomiting. And the last one I have here is the Marburg disease. Marburg disease falls in the same group of hemorrhagic viruses as Ebola. It is a highly fatal disease which includes bleeding from the internal organs and bodily orifices. Marburg disease was first identified after 2 big outbreaks in Marburg and Frankfurt in Germany, and Serbia in 1967. Initial infections were caused by prolonged exposure to mines or caves inhabited by the Rosetta bat colony. How is it contracted? The Marburg disease is spread by fruit bats to humans and transmitted from human to human via bodily fluids. Marburg and Ebola viruses are considered to be zoonotic infections transmitted to humans from life cycles in other animals, although it's unclear as to which animals contain both Marburg and Ebola. It is thought that both may be transmitted to humans from monkey or bats. There is no evidence for any insect vector, although it's unclear how humans contract these viruses from other animals, perhaps by eating them or by contamination of animal body fluids. It's clear that human-to-human transfer occurs by direct contact with an infected person's bodily fluid. For example, saliva, tears, excretion, vomitus, and blood. The Marburg viruses are not thought to be spread by air droplets. Signs and symptoms of this disease. According to the World Health Organization fact sheet, Marburg disease has an incubation period of 2 to 21 days. The symptoms start suddenly with a high fever and severe headache. Severe diarrhea and vomiting also occur, as well as bleeding from the orifices and gastrointestinal tract.